it's really, and this is where the, political action committee from the American College of Cardiology is really not a left-leaning, right-leaning. It's, as we like to call it, it's the cardiology party. We're focused on our patients. We're focused on our profession. And when you think about it that way, which is a shift in thinking, you're much more likely to get over that inertia and say, you know what, maybe I will get involved.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. So this episode is with a colleague, a partner, and a dear friend, Dr. Vijay Rao. I got introduced to Dr. Vijay Rao, when I moved from Ohio to Indiana. This was last year. He graciously reached out to, seek my participation in one of the conferences, the annual conferences for the Indiana State Chapter for the American College of Cardiology. So for those of you who do not know Dr. Vijay Rao is the current governor, so the incumbent governor of the Indiana chapter of the American College of Cardiology. He is also the director of heart failure and cardio-oncology at Franciscan Health in Indianapolis, in Indiana. So with that introduction and with that preamble, Vijay, welcome on the show, and thank you so much for doing this for us on a Saturday morning.
Oh, it's my pleasure, Ankur, and thank you so much for the invitation. Really looking forward to our conversation.
Yeah, likewise. So, Vijay, like we were talking, off the line, I've known you for about a year. It was about this time last year when I made the move from Ohio to Indiana, and you graciously reached out to me as the incumbent governor of the Indiana chapter of the American College of Cardiology, which, by the way, has been a very prominent chapter for the ACC. I think if you look at all the chapters nationally, then the Indiana chapter stands out, also in part because of how many have then reached, moved on to serve the college, nationally, from our state. So I'd like to start this conversation by asking you as to, what motivated you to seek a position as the Indiana chapter governor, because I do know that you are a very busy clinician and also a researcher. I mean, you are involved in cardio-oncology networks, nationally and, if not globally. So, with a busy clinical practice and with an interest in research, how did you then carve out time and motivation to seek for something like an, important, I would say, administrative position for the state chapter?
Yeah, no, that's, thank you for that question. I think it goes back quite a few years when I was just getting started in my practice here at Franciscan. I had just completed training as a advanced heart failure transplant doc out at the University of California, San Francisco, and was sort of in this academic versus private practice kind of conundrum. Spending most of my career as a MD PhD, doing basic science research, doing some clinical epidemiology and biostatistics when I was out in California, really trying to figure out where I could make the biggest impact for our patients, and ultimately ended up, thankfully in a terrific position at Franciscan in Indianapolis that has allowed me to do a little of all of those things that I just mentioned, save the basic science. From that perspective, I've gotten quite involved with the research program at Franciscan, doing a lot of clinical trial work. It is a busy clinical practice, really enjoyable practice. So got, dug in when I jumped into my current group and started to get involved with the heart failure program and a number of other initiatives, quality initiatives around the hospital. And at that point, probably about 3 years into my early career, started to get more involved with the American College of Cardiology. It really serves as a professional home for cardiovascular healthcare professionals. At that time, Dr. Ed Fry was the governor of the Indiana chapter of ACC, who just completed an amazing year as our national president. But at that point, really wanted to take a lot of what I was able to accomplish and learn from my experience at Franciscan and be able to start working with others around the state of Indiana to see if we could improve health for individuals across the state. I grew up here in Indianapolis, consider myself a Hoosier, born here at IU, and I just feel like, unfortunately, despite having really strong healthcare systems in Indiana, we still have some of the worst outcomes from a cardiovascular perspective in a number of different areas. So those are some of my initial motivations to try to get involved with ACC and see what the group and the Indiana chapter could do. So I had 4 years on the Board of Governors of Indiana, working with folks across the state, and really enjoyed that position. I think what I really liked about it is there was a focus on developing leaders. There was terrific annual meetings where I got to network and work with fellows in training who are our future, working on the planning of the meeting and the programs and all that sort of thing. And I just really felt like the organization was doing a lot for our patients and our profession. So after those 4 years, there's a limit in terms of the number of times you can run for that Board of Governors. I think it was a fairly active and engaging group of individuals that rotate on and off. Was actually invited every 3 years. There's a new Indiana ACC governor, and having worked with the prior governors quite a bit on a number of different projects, I think most recently of which was the pandemic virtual webinar series, where it became very difficult to try to bring people together in person. I sort of spearheaded, along with Don Westerhausen, our former governor, a number of different COVID-related webinars that were focusing on, how to handle workflows, and I think those were really well received from folks across the state. And at that point, I was invited by the prior 3 governors get together, and they sort of put a list of folks that they think might be good candidates. I was invited about a year and a half ago to apply. Thankfully was given the opportunity, and here we are 1 year later. Time flies, but that's kind of how I got involved.
Yeah, no, excellent. So, and you've brought up, there's a lot to unpack here. You brought up the poor state of Hoosiers, unfortunately, despite having robust healthcare systems across the state of Indiana. And, that is something that I will talk to you more about later in the conversation when we talk about advocacy. But before that, for someone who's interested, early career fellows in training, or even mid-career, people who are interested in getting more involved with the American College of Cardiology, nationally, I've been told, by, friends and colleagues who've, like yourself, been, involved at the state level, that, that is where you start. It's sort of very similar to, our political system in the US, that you start at the grassroots level. You start by getting involved with your state chapters. So if someone who's interested in getting involved with the state chapter, with the Indiana state chapter, and this is for fellows in training and early career or even mid-career, this is for the vast majority of our listenership. What would you recommend them? How should they approach, this is not only for our state of Indiana, but for, other state chapters across the 50 states. What would you tell them as to how to approach the leadership of the state chapters? Could they just write, like a cold email? Is that something that is welcome, or is there a specific channel through which you have to approach if you're interested in getting involved?
Yeah, I think it's extremely important. The future of our profession really depends on engaging our fellows in training and early career members. And there are multiple ways individuals can do that. And there are national sections. So, for example, topic related heart failure imaging, but there is a national fellow and training group. But to your point, I think that the easiest way to get engaged with ACC is to do it at your local level, working with your, every single chapter across the country has an annual meeting, for example. There are opportunities there to present your research as a fellow, be able to get on speaker panels as a junior faculty member, both as well as an academic as well as private practice folks. And I think that's a great way to engage with your chapter, is to start getting more involved at the annual meeting, networking, showing interest. I think if you just come forward, in our profession, we have a lot of type A folks, a lot of people who really like to accomplish a lot. They're very driven. And I think one of the key aspects is to, approach your state governor, your mentors within your own institution, many of which are involved with ACC, and figure out ways that you can get more involved. But starting with the annual meeting, I think, is a great opportunity. As far as the legislative piece, there's opportunities for FITs as well, fellows in training, as well as junior faculty to get involved with advocacy. There's a National Legislative Day, and I know we'll talk more about advocacy later in the conversation, but those are opportunities for anyone who wants to get involved and advocate for your patients. There are statewide legislative days, which we just had recently, which we had an opportunity to work together on, as well as national legislative days. And then, of course, the ACC meeting itself, I would encourage all members to attend the national meeting. It is a large meeting. I believe there were 35,000 members that recently attended approximately the New Orleans meeting that we just completed. And there are lots of opportunities by engaging at the national meeting with your local chapter, as well as within your area of expertise. I think that's another important piece, is people start to differentiate themselves in the sense of their clinical interests. For example, for me, it was cardio-oncology. And so to be able to engage with members in the subsections of your specialty with ACC is another great way to get involved at sort of both a local and national level.
Yeah, no, thanks. That's a terrific answer. So Vijay, for in terms of fellows in training and early career who then want to further their path within the state chapters, you certainly, for you, the work that you did with the Indiana chapter of the American College of Cardiology was noted, and it came at a time when that opportunity presented itself, and I'm sure you would have done a terrific job, as you are with the Indiana State chapter. Is it? I know your work speaks for itself, but is there, are there scouts? I'm asking this for myself as well as for others who've asked me this question as to, what is the process of getting picked for the position of a governor for the state chapter? So are there are there chapter scouts that are past governors that are looking for future governors, and is there a certain level of participation in a state chapter that is required, that is at least the qualifying line for someone to demonstrate their interest or even be considered for this position?
Yeah, the ACC takes leadership very seriously, and including leadership institutes and a number of other national initiatives. But I think the most important way that ACC goes about this is they constantly are looking at the board of trustees. So there is a group of about 18 individuals from around each state, which are on the state board of the ACC. And as I was mentioning earlier, I had two 2-year terms as a statewide representative. And that's an opportunity for an individual. And that, by the way, that includes FIT members. So fellows in training are part of that board. There are positions that are dedicated to that. So that's a great way for a fellow in training to get involved, is to apply for one of those positions on the statewide level and get involved, like I did, with the statewide activities. As far as the governorship, that really is coming from the group of individuals who have been on that board. So when you say in terms of like a recruitment board or what, it really is the prior governors who are looking at individuals who have been on the statewide board, who have contributed to the overall mission. And, you know, as you point out, folks are very busy, you know, with their clinical practice. We all have, you know, leadership opportunities within our own institutions. But when it comes to, you know, being able to balance, being able to do what you do at your local level, but also giving your time and effort to the statewide chapter, I think that's what's recognized by prior governors. It's folks who volunteer to help with planning the statewide meeting. It's individuals who, you know, show up and attend the legislative sessions and provide input. So I think it's definitely, and to your point, we have a meeting coming up in a few weeks. I mean, I'm just 1 year in as governor of a 3-year term, but we have a meeting with the prior governors in a few weeks to start talking about the pipeline of individuals we want to put forward for consideration for the next governor, which is 2 years from now. You know, one of the things that ACC also does is they have a year in training. So there will be an election. The next governor will be voted in across the state. And then that individual will have a year to kind of train, with me, coming to meetings, going to the Board of Governors meetings at the national level, and kind of understanding the whole process. So someone doesn't just jump right in and not have a sense of what they need to do, which is really great from the perspective of developing, allowing people to hit the ground running when they start their new position.
Yeah, no, I mean, this is just terrific content, Vijay. Thank you so much for sharing this for us, because for a lot of us, it's sort of the unknown. It's the black hole. You just don't know what transpires, but it certainly sounds like that there is a very robust method to this madness. It's commendable how seriously the college takes leadership. So thank you for bringing this to the fore for the listenership. I think this would be enlightening to many, as to the process of getting involved at the state level, and then a year in training for the leadership at the state level is fantastic, and I'm certain is also emulated at the national level. Is that right? Or
yes, that's exactly right. I mean, I think they develop, for example, I sit on the Board of Governors, where that's the governor of each of the states meets together, and they called the BOG for short. But that group often, every year has a chair, and they have a steering committee, and there's a chair-elect. At the national level, certainly there's a president, there's a vice president, there's a secretary-treasurer, and there's always a group that is collecting individuals that they think would be good candidates for that, and having them get into the training mode where they can be involved. And so it occurs at every single level of the organization, is constantly looking at who the next individuals are that can step up to continue to grow the college. So yes, it occurs really throughout the organization. And it's really, I think, one of the real strengths of the organization. Excellent.
So, what has, in your role, and as you were pursuing this, the 1 year in training, and then with the 1 year that you've been at the helm for the state chapter, what has, in your opinion, or in your evaluation of this role, what have you? This is a 2-part question. The first part is, what have you learned the most? Sort of which may have been a blind spot for you, and then the second part of the question is, how has this role made you an even better professional than what you think you were?
Yeah, I mean, two good questions. I think the first one is in terms of what I've learned about myself through this process. I think, having worked with folks at Franciscan at my own institution and doing a lot of committee work and leadership, I think it becomes very obvious that in order to be a leader, one really needs to find individuals with passion, be able to figure out how to motivate other individuals. I think what we get so caught up with is individuals, doing most of the work and trying to improve outcomes for patients and et cetera. But you really can't do that in isolation. It's easier to do a little bit on a local level, but as you're starting to branch out and try to make big sweeping changes, sort of at a state level and a national level, you have to create a group of passionate individuals. You have to be able to motivate others to give of themselves. And that's difficult. I think, to your point, everyone is so busy. Everyone has got their family life. They have their work life. They're trying to find that balance. And, there's only so many hours in the day between writing papers and doing things. And so being able to, speak to others, to be able to motivate others that there's a reason to put some time and effort into the ACC. That I think was probably the most eye-opening thing for me is to be able to recognize that one individual, really can't accomplish very much, but a team of passionate individuals who are motivated can accomplish anything. And in our field, in other fields, there are so many talented individuals who, haven't been tapped. They haven't been approached. They haven't been given the opportunity to do those things. And so I think, learned that I'm becoming better at identifying and every individual has something to offer. So being able to recognize the talents that individual people can bring to the table that could then help the overall organization is a skill set that I think over the last year I've really started to hone, and recognizing that, we can't accomplish much without that. So I think that's probably the biggest thing for me, to answer your first question. Probably part of what I just answered was more your second question. And the first question was
what in your opinion or in your assessment of the year that has gone by, what do you think was your blind spots or something which you were not aware of, and over the past year you've become more aware of, after having assumed this role?
No, that's a good question. So I think that to answer your first question, and I think we'll get into this in a little bit, is how important advocacy is. I think in this last year, I had never really participated in a significant way on the advocacy front. I knew about what was going on nationally with certain topics, and I would contribute a little bit here and there. But I think the blind spot was that, wow, advocacy really, really matters, both for our profession, but as well as for our patients. And that without jumping in and really committing oneself and motivating others, we can't accomplish very much in terms of, so much of what occurs in our profession is happening at the legislative level, whether it comes to reimbursement, modes of care, value-based care, quality, equity. All of these things are absolutely critical to the day-to-day things that we do. And I think as we go to work every day and take care of our patients, we lose sight of that. And I think we as a profession, as a healthcare provider, and myself personally, need to step up and, make our voices heard. I think traditionally physicians, healthcare providers have not been very good advocates. We have not been very good about going to our legislators and convincing them that these are important issues to us. Many other professions, as you know, in our government system, with lobbyists and other folks who are able to really move the needle for their own causes. And I think traditionally we have not been good at that. So I think that was probably the blind spot that I have recognized as an individual, but as well as a profession. We need to really start engaging more on the advocacy front. And there's so much that can happen. And I'll just give you one quick example. As coming in as governor, as you know, a very hot topic was the overturning of, the Roe v. Wade with the Dobbs decision. And you think, well, how does that impact a cardiovascular profession? How does that impact me as a governor of Indiana ACC? And very rapidly, I came to realize that, the impacts, whether you're pro-choice or pro-life, the bottom line is the women who are pregnant have a lot of, it's the leading cause of maternal mortality is cardiovascular disease. And there are a lot of these women have cardiovascular conditions that may preclude or make it difficult for them to actually carry a full pregnancy. And so, being, not really recognizing that, but coming to the fore immediately, we and I think in large part, I'll give a lot of credit to Dr. Mary Walsh, who was a former national ACC president and very staunch advocate across the state and nation for women in cardiology as well. But we had worked together quite rapidly, having to go to the state house and start, bringing up the topic of maternal mortality and maternal health, that there may need to be exceptions, that it shouldn't just be an all-out abortion ban, that there are exceptions for the life of the mother and the health of the mother. And those are things we put forward that I don't think that voice was getting out there. So I feel like we were able to do that. But, those are things that just came up immediately. And I think most people wouldn't have thought of that. Most people, didn't know how to, realize that was even an issue, to be honest. So I think that's just one example how advocacy matters.
Yeah, no, it's profound. And, it's such a great answer in advocacy because after I spent that day with you earlier this month, the legislative day for the state, and, we were at the state capitol building all day together. And I sort of was learning how to, so first of all, thank you for providing us with all the materials. They were very well organized, detailed. And, for someone who's not done advocacy at all, or been at any of the legislative days, I'm talking about my experience here and as to why this is such a blind spot for so many of us, that, and we are really good at reading stuff. We read so many articles and journals and we try to, just inculcate and imbibe all that information into our daily practice. And, what was eye-opening for me at the end of that day was, how important it is to be a voice of your profession at the advocacy level, because there are decisions that are being made, which are going to impact each of us individually and collectively also as a profession, and also our patients. And, to me, it's like the two most important stakeholders are the doctors and the patients. And I'm not sure if any of us are at the table, So, that to me was such an eye opener after that day that I was like, this is so important. Like, this is crucial, to have our voice, be heard by, the senators and the representatives. And, these are the people who are making decisions. And, I think they're good people. I think the depth perception of the topic that you and I would have as cardiologists they would not have that. So it's so important to present our perspective to them so that they can also make fully informed decisions about, policies which are going to affect so many of us, right? So it's a great answer because, that you said advocacy and I was nodding my head that, for me that day was such an eye opener, for me as a person, as a physician, as a cardiologist, taking care of patients. But to your point on, Roe versus Wade and how that would impact our patients, many of whom are, pregnant women with underlying cardiovascular conditions. And, we just presented the national data last year at the American Heart Association annual scientific sessions. That paper was published in the European Heart Journal. The two conditions that come to mind immediately, right, would be, postpartum cardiomyopathy, which would be a deterrent for future pregnancies, because that would be harmful for our patients. And, we take the oath of doing no harm no matter what. And then the second big one is spontaneous coronary dissection. And I'm not sure I'm sure you would have addressed these conditions as the governor, but is that is, I'm understanding it correctly, right, as to what you explained?
Yeah, I think those are certainly conditions that would impact future pregnancies. But, other things like severe pulmonary hypertension, like stenotic lesions with aortic stenosis or congenital heart disease. Those are other, aspects, in addition, that if a woman were to become pregnant could have catastrophic outcomes, both for her as well as her baby. So, yeah, I think there's a spectrum of conditions that, and to your point, I think, legislators are trying to do the right thing, but I think that they really need content experts, which are the, healthcare professionals. They need to hear what's going on the ground. They need to hear examples and testimonials of what this means to their constituents, their patients, our patients, their constituents. And I think the other point I would just make about it is that, political discourse is so polarizing that I think when people start to think about it, and I'm speaking here to all of the sort of cardiovascular health professionals, is, one would just say, well, I'm not going to get involved with that. It's too polarizing. There's the Democratic side, the liberal side, the conservative side. And I just don't want to have to, I've got enough stress in my life. This isn't something I want to kind of, jump into because, nothing ever gets done in Washington, et cetera, et cetera. But I think that the perspective, the framework should shift, that it's really, and this is where the, political action committee from the American College of Cardiology is really not a left-leaning, right-leaning. It's, as we like to call it, it's the cardiology party. We're focused on our patients. We're focused on our profession. And when you think about it that way, which is a shift in thinking, you're much more likely to get over that inertia and say, you know what, maybe I will get involved. I'll show up for that legislative day. I'll see what I can do. And I encourage others like you did recently to come to our legislative offerings and kind of learn the ropes. And I think you'll see that, again, it's yes, you are talking to folks on different sides of the aisle and there are different viewpoints. But when you come at it with the perspective of, I'm really here to advocate for patient care, you're here advocating for your profession, really a lot of that polarization starts to melt away and you realize that you can get a lot accomplished. So that would be, I think, an important message for your audience.
Yeah, no, it's, very eloquently put, and thank you for putting it across in that fashion. Few 8 to 10 minutes left for the show and for the podcast episode. And, thank you. This has been such an enlightening conversation for me as a cardiologist who, has had the opportunity to work with you recently on Legislative Day and, also sort of getting involved with you at the state chapter for our upcoming annual meeting. What are a few things which, in your tenure of two years as the governor, you want to accomplish as the state governor, and then maybe we can talk about some of the disruptive topics you think you are bringing to the fore as the governor. And you've been very collaborative and forthcoming with getting individuals like myself on board, to sort of hear our voices on what may be some of the disruptive ideas that could be presented at the state forum. So thank you for that. But I'll have you start by answering the first question, which was, what are some of the tasks you would want to see accomplished in your tenure, in the remainder of your tenure? Yeah.
Yeah. Thank you for that question. I think, we've really focused a lot on advocacy in this first year. And I think we certainly want to continue, we've built a lot of relationships. I think even more so in the last year as governor, than we have done in many years prior. And I think I'd like to see us continue to, develop a cohort of individuals such as yourself and others, the leaders around the state, to develop stronger relationships and ties to be able to put our cardiovascular voice forward in the state. So number one, I would say, is build on the successes we've had and start being able to, and the other aspect of that, which we haven't talked about, is being able to bring bills forward to the legislature. So the Indiana State Medical Association is sort of the forum for doing that. And I am going to try and encourage more of our members to, be able to think and put some of these bills are not that hard to actually put together when there's a pretty simple format. So being able to come up with ideas that can improve health in Indiana and be able to take that forward on any number of topics. We don't have time to get into all the details today, but I want to continue to encourage and develop and foster that strong advocacy tie that we have in the state. So that would be number one. We have a couple of subsections. We have a new developing heart failure subsection that Dr. Maya Guglin at IU is going to help lead with Dr. I believe it's Adegopala from Community. And we are, I'm looking forward to seeing what they're able to accomplish. I want to support that group. I think we would like to see improved heart failure outcomes across the state. We have new therapies now with guideline-directed medical therapy, which is grossly being underutilized at a national level, but as well as in the state. So I'd love to see how that group and support that group and trying to come up with initiatives to, track that sort of information, identify barriers to access around the state, and try to think creatively how to support that group. So that would be a second topic that I'm excited about. And then lastly, we've got the Indiana subsection of cardio-oncology, which I started a couple of years back, is just got a grant from the ACC, a 3-chapter grant, Texas, Washington State, and Indiana. And we are working on a mobile app platform to be able to carry health information and specifically in this case, cardio-oncology, that could be linked to the cloud that will be portable for patients as they travel across state lines. And this could then be used by adult congenital patients. As you know, we see some of these folks and the patients have no idea what they got 5, 10, 15, 20 years ago in terms of the chemotherapy, in terms of the radiation, in terms of the surgical aspect of adult congenital heart disease. So we are partnering with the ACC Innovation Section. We're working, we just got the grant about a month ago, and Vlad Zaha in Texas at UT Southwestern and Richard Chang in Washington State, the three of us and our respective chapters are looking to develop that over the next year and then start to spread that information out and make it accessible to all of ACC as a both Apple and Android app. So I'm excited about that. I'm going to be putting a fair amount of my effort and attention to that. So those would probably be the 3 areas that I would throw out there for you.
Yeah, excellent. And then, just to wrap up the episode, maybe, just a shout out to our upcoming annual meeting, I think, which would be in September. Do you want to just talk to, local folks in the state about the upcoming meeting and, what do you see in terms of, the topics and the speakers that are going to be talking to us about at the meeting?
Yeah, no, so of course the meeting has we went back in person this past year after 2 years of being virtual. Very well attended meeting, a great opportunity to network. We presented Dr. Feigenbaum with the Career Award for his incredible contributions to both echocardiography as well as ACC. And we're looking to build on that. So this fall, the incoming, and to your point earlier, this is the incoming national president, Kathy Biga, who will take over the following year for Hadley Wilson, who's our now current national president, is going to be our keynote speaker. She will be talking about, the national ACC initiatives and kind of give us a general overview of where the college is going. She also brings an incredibly deep background in the business aspect of medicine and understanding workflows and quality and value. And so she'll bring that, I think, perspective to her talk as well. We are going to be talking about, we really want to get our FITs engaged. So we are having a discussion about having the FITs in each of the different general cardiology, heart failure, and EP to present some of the top clinical trials in each of those spaces to the group. So it's always great to engage the FITs. And there'll be a poster competition, which we have every year with awards for FITs. And so we look forward to that. Dr. Walsh, has recently led a group that had a JACC paper published on alternative pathways and careers in cardiology. So, finding that life-work balance, I love that term, life-work as opposed to work-life, and trying to, engage. We have a cardiologist, a retired cardiologist, who's going to be coming back to our practice at Franciscan, who's helping with workflows and reading vascular studies. And we have a huge shortage in our workforce in the cardiovascular field that are projected over the next 5 to 10 years. And we have to think, and we have a baby boomer population of cardiologists whose average age, is in the 60s. So we have got to think creatively about how to handle that. Some of it is, the engagement of our advanced practice providers. Some of it is being able to have career flexibility in terms of, part-time, as well as some of our retired cardiologists. So I think that's going to be an outstanding panel discussion that I think will benefit all of the members coming to the meeting. We're going to have another group talking about cardiomyopathies, both amyloid as well as sarcoid, two really important aspects of cardiomyopathy care, which there have been a lot of breakthroughs in that space. And so we have some really terrific speakers coming to talk to us about that. And then lastly, we'll have a discussion on antithrombotic therapy. So I think a real wide spectrum of topics, a terrific meeting. I encourage all of the Indiana ACC members to attend. And I do think, give a special shout out to you, Ankur, for being part of the panel or the part of the team that is working to put together all those topics. Your contributions in the short time that I've known you to ACC have really impressed me. And I look forward to, your continued engagement and, hopefully we can get you to apply for the Board of Governors and continue to stay engaged with us on a statewide level. So thank you so much for all that you've done in the short time that you've been in our state.
Oh, no, just thank you for the opportunity and thank you for reaching out and thank you for considering me, someone who could contribute. I'm more than happy to, be of both contribution and resource to you as well as to the state chapter. Vijay, this has been a fantastic conversation. Thank you for sparing, time away from family on a weekend morning with us. And
yeah, thank you. I appreciate again the opportunity and this podcast delivery is really a terrific media advance, and I really look forward to hearing many more of your podcasts as you continue to do this work. So, thank you again, Ankur, and thank you to the listeners as well.
Yeah, thanks a lot.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.